Hey everyone, how are you doing? Today we're going to be solving some cases on the 3 lectures of the Neuroembryology. We're going to be solving 6 cases. I hope they are useful and they cover most of what we talked about in the previous 3 lectures. So let's get to it. Case 1. A 34-year-old woman. So first of all, I need you to pause the video and try to solve it on your own and then play the video, okay? So a 34-year-old woman, gravida 3 para 1. We're going to be talking about that in reproductive. Don't worry about it. Gravida 3 is basically 3 times pregnant, para 1 time delivered, okay? She delivered once, pregnant 3 times, okay? So she comes to the office for prenatal evaluation. The patient says she had been using condoms for birth control and unintentionally became pregnant. Oops. Her last menstrual period was 2 months ago. Home pregnancy tests were positive. Here we go. She has not been taking prenatal vitamins, including folate. We got a problem. Houston, we have a problem. Now the baby is at risk for having neural tube defect, okay? The patient has a healthy 3-year-old daughter, lucky her, who was born after an uneventful pregnancy. She has a history of rheumatoid arthritis for which she uses methotrexate. Oh boy, that's a double threat right there. So she's not taking the prenatal vitamins, and in addition to that, she's taking methotrexate, which inhibits the formation of folate. So she's not taking folate, exogenous folate, and she is basically inhibiting the formation of folate. So this patient definitely has folic acid deficiency. The patient has no other medical conditions, no medications, no tobacco, none of that. Vital signs are cool, examination cool. So the unborn child is at greatest risk for which of the following? We talked about that. Neural tube defects. There is basically 0 folic acid in this patient, okay? Case number 2. Pause it, try to solve it, and then play the video. 35-year-old woman, gravida 2 para 1, come to the office, prenatal visit, first child, has hydrocele-syndactyly. Forget about that, we're going to be talking about that later. Hydrocele is something in the scrotum. Syndactyly is basically, a fusion of the fingers, right? First and second toes here. Patient cool, no conditions, no medications. She takes multivitamin, good lungs, good heart, good abdomen. Uterine size, everything normal. Patient undergoes amniocentesis, amniotic fluid, increased level of acetylcholinesterase. She might be having neural tube defects, okay? This result most likely suggests failure of which of the following. Okay, so this patient has neural tube defect. So the question basically is, a neural tube defect is basically a failure of which of the following processes? Thyroglossus, hell no. Meiotic, hell no. Migration of neural crystal, hell no. Heck no. Fusion of the edges of the neural plate. Remember, the neural tube is basically the neuroectoderm, and then this invagination starts happening, and the neuroectoderm, aka the neural plate, then closes and forms the neural tube. So failure of this fusion will cause a neural tube defect. So the answer is E. Case 3. Pause the video. I'm not gonna keep saying this every damn case, all right? You know the drill. Pause the video and then play it. So a 17-year-old obese primary gravida comes to the ER, active labor, concealing pregnancy. That's not a good thing to do. Patient did not receive prenatal care or take prenatal vitamins. Not a good thing to do. Fetal heartbeat is undetectable. Yeah, no shit. And she delivers a stillborn baby. Good for you, lady. Okay, I'm acting as if it's a real patient. Okay, examination of the stillborn shows several dysmorphic features. Closed set eyes, midline mass, proboscis. Remember the proboscis, which is this primitive non-functional nasal structure, and fused cerebral hemispheres. So the case basically is telling you this patient has holoprosencephaly. Okay, absent forebrain fissure. See, there is no separation, and a single intracranial ventricle. This is basically clue after clue after clue after clue that he basically is telling you this patient has holoprosencephaly. I swear this patient has holoprosencephaly, right? So here, closely set eyes. All right, you're still not sure? Okay. Midline mass consistent with proboscis. Still not sure? Okay. Fused cerebral hemispheres. Still want to be more sure? Okay. Absent forebrain fissure. Not really sure. Okay. Single intracranial ventricle. He's basically like giving you the case. Okay. This is holoprosencephaly. Which of the following is the most likely mechanism for these findings? So which of the following mechanism leads to holoprosencephaly? Which one of those? Remember, holoprosencephaly may be caused by a problem in the sonic hedgehog signaling pathway, which leads to developmental defects in other parts as well, not just the brain. The patient can have cleft lip and palate, proboscis, as we're seeing in the case. So a lot of other stuff. So which answer is correct? Field defect. This is a developmental field defect. Case number 4. I'm not going to tell you I'm not going to tell you to pause the video. You already know. A 4-day-old girl is seen in the clinic after discharge from newborn nursery, 38 weeks, no problems. Examination, everything cool. Tone, cool. We have a deep sacral pit with a hair tuft over the midline in the lumbosacral region. Okay, everything else is cool. Okay, so basically this patient is totally okay. She just has a sacral pit with a tuft of hair in the lumbosacral region. So this is a case of spina bifida occulta. So the question is, failure of which of the following may lead to spina bifida occulta? Anterior neural tube? Nope. This here, the spina bifidas are all posterior neural tubes, so this one is wrong. Myelencephalon division? No. Again, the spina bifida has absolutely nothing to do with the forebrain, midbrain, hindbrain, or anything regarding the anterior neural tube. Okay. Neural crest cell migration? Nope. Notochord separation from the endoderm? Nope. Vertebral arch fusion. Like we talked about before, the spina bifida occulta has no problem with the neural tube. The only problem is that the vertebral arch is not fused. There is no herniation, no elevation of alpha-fetoprotein, nothing. Just a simple vertebral arch fusion. This can be missed on ultrasonography, hence why it's called occulta. And the only thing we may find is a tuft of hair or a dimple in the lumbosacral region. So the answer is vertebral arch fusion. Case 5. 28-year-old woman, 20 weeks gestation, comes to the office for her first prenatal sonography. Okay, congenital defect, no cardiac activity, pregnancy loss. Okay, after delivery, the fetus is shown here. These findings most likely due to an impairment of which of the following? Okay, this is a stillbirth. Okay, as we can see here, this is anencephaly, no brain. So an impairment in which of those things can lead to anencephaly? Anterior neuropore closure, or rostral or cranial neuropore closure. If there is a failure of the rostral neuropore closure, we'll get anencephaly. So the answer is A. The last case, 32-year-old woman, gravida 1 part 0, 35 weeks. Absent fetal movement. Patient has had no prenatal care. Sonography, fetal demise. Incomplete separation of cerebral hemispheres. So this is holoprosencephaly. This question is incomplete, probably. So it's basically saying which one of those can predispose to holoprosencephaly. We talked about two things, the fetal alcohol syndrome and trisomy 13 or Patau syndrome. So the answer is D. Well, that's all, folks. I hope you guys find that useful. I hope you found the neuroembryology useful, and I'll see you in the next videos. Have a good night.